Okay, so good day everyone. For today's video, you will be learning what you need to know about herpes viruses or herpetic mucocutaneous infections, which are the infections that they cause. So to start, let me introduce to you our reference from our discussion. It is the Henry's Clinical Diagnosis and Management by Laboratory Methods. It is in chapter 55, page 1042. So to officially start our discussion, so let me introduce to you the rangers. So truly yours, I am Eden Mary Inting, and I will be discussing about the general characteristics of the herpes viruses as well as their diseases that they cause. And next, we have Najmia Aimim Bantas, which will be discussing the laboratory diagnosis, and Ms. Siti Rainisa Haji Sirad, which will be discussing the specimen collection regarding the herpes viruses. And for the treatment, we have Carmel B. Maglasang, and for the prevention and control, we have Tricia May A. Montejo. So now let's know first what are some basics about herpes viruses. So herpes virus, they are known to be ubiquitous, meaning they can be found everywhere, anywhere. So that is why we need to be more cautious in our environment because they can be present everywhere. And they are also called alpha viruses together with the varicella zoster virus, or that is what we call double-stranded DNA. They're common worldwide and they produce infections in the skin and squamous mucous membrane surfaces of the body. So from the title of our study, that mucocutaneous infection, so meaning they infect primarily in our skin. So okay, a little recap about herpes viruses. So this one is discussed from our semi-final topic. So I will just have an overview about herpes virus. So nucleic acid and A, of course, because again, they are called alpha viruses, which are double stranded DNA. Capsid symmetry, icosahedral envelope, two-bed envelope family. They belong to herpes viridae virus. Viruses, this type of virus has two serotypes, the herpes virus serotype 1 and the herpes virus serotype 2. And their genome size is about 120 to 200 kilobytes. Since I already mentioned that this herpes virus has two serotypes, the type 1 and the serotype 2. So let's, though they have both some similarities, but more specifically, we have to distinguish the two for its better identification in the laboratory as well as for their treatment. So let's focus first on the serotype 1. So mode of transmission in the saliva and the body parts, it infects primarily in the oropharyngeal and the labiofacial surfaces, so meaning they infect more primarily in our mouth, in our tongue, and even in our lips and around our mouth or lips or in the faces. These are the full infections that they cause. Herpes glandulorum, so it refers to the skin lesions to the skin that is exposed to more specifically on the athletes. So since this herpes virus, they are ubiquitous. Again, they can be found everywhere. So that is why our athletes are prone in this type of virus. Because of course, they are players, they are athletes, and that they primarily stay outside. And next, for the infections, we have herpetic wet loss. So this refers to the infections on the hands of our medical practitioner. So they are also expected to be more exposed in this type of virus because they work in hospital, they work in various in many people. And it is also known to cause encephalitis or inflammation in our brain. So now let's proceed to the serotype 2 herpes virus. It can be transmitted through intimate sexual contact, and the body parts it infects primarily in our genital area or genital surfaces. And it's infections, it cause, of course, genital infections, and it can cause also meningitis. A little illustration for you to be able to visualize it more. So this is what I mean about oropharyngeal and labiofacial surfaces. So near our lips or mouth. And for the genital squamous surfaces, so it is already understandable that it can be infected or it infects primarily on our genital area. Okay, so this is what it looks like, what exactly it looks like for having oral herpes virus serotype 1 infection. Skin lesions around the lips of the baby. And this is the herpes gladiatorum, or if you still remember the skin lesions on the exposed skin of our athletes. And this is the herpetic wet low, which is the infected hands of our medical practitioner. And for the herpes virus serotype 2 infection, so never mind this oral word here. So again, it primarily infects in our genital area. For this serotype 2. And for the diseases it causes, so it infects primarily, or it causes for these following infections, of course, herpetic mucocutaneous infection. So from this word mucocutaneous, meaning within the skin. So of course, it may cause skin lesions in our mouth and our lips. And this also leads to some respiratory syndromes for pediatric and adults, more specifically influenza. So though influenza, it is a disease in our respiratory, so we already know that it is primarily caused by influenza virus, but herpes virus can also cause influenza. But this topic is more, or will be elaborated more for the next group of reporters. And it is already out of scope, but still we're trying to give a little background of it. So next in line is the laboratory diagnosis for this herpes virus, which will be founded by Miss Najmia.
So thank you so much to the previous reporter. And for my part, I'm going to discuss the laboratory diagnosis of uh, I'm going to discuss the laboratory diagnosis, which I prepared the three parts, which is the cell culture isolation of herpes simplex virus, the nucleic acid-based detection of herpes, and the direct detection of herpes simplex virus. So first one, HSV grows exceptionally well in variety of cell lines. However, in primary monkey kidney PMK is not reliable. So when we say other cell lines, we have the human fibroblasts, rabbit kidney, mink lung, HeLa, rhabdomyosarcoma, Vero, and the hep dash 2. So this kind of cell lines, HSV grows exceptionally, but not in monkey kidney. I have here the two tissue culture tubes. First one, we have the 1RK and 1R MRC dash 5. So these two are usually inoculated. HSV replicates rapidly with CPE usually apparent after 1 or 2 days of incubation. Genital cultures that fail to show HSV CPE after 5 days of incubation can be reported. So dapat they must show HSV CPE for like 1 to 4 days of incubation. Hindi it failed to show within the 5 days of count. It must be reported as negative. Incubation of cultures from central nervous system, CNS, corneal, and oral at a non-genital site should be extended for 2 weeks so that the other viruses such as adenoviruses and enteroviruses could be or may be recovered. Next slide. Individual HSV infected cells become swollen and rounded. So these are the two characteristics that that would be seen when you culture HSV, and this damage spreads rapidly across the monolayer. Confirmation with DFA stain is needed. So di ba sabi ko nga, swollen and rounded, that is the characteristic of a herpes virus. So they could be confused with other viruses and toxins like trichomonads, and they could be confused with that. So for confirmation that it is HSV, we have to confirm it using the FA stain. With the use of shell vial centrifugation enhanced culture, HSV can be identified in the monolayer by DFA staining after only 1 day of incubation. The LVIS HSV shell vial culture system uses genetically altered cells that develop blue nuclear color after 1 day or less of HSV replication. So this system is used routinely because it is simple and very sensitive method for HSV culture. Next slide, please. So we have here the nucleic acid-based detection of herpes simplex virus. Real-time PCR followed by melt curve analysis is commonly used for the detection and typing of HSV. The wide variety of specimen types can be accommodated with molecular methods. So it includes swab specimens, VTM or universal transport media, cerebrospinal fluid, bronchoalveolar lavage, frozen tissue specimen, and then the FFPE tissue. PCR quality DNA can be extracted by a variety of commercially available methods. So when we say method, they could be manual or automated. Specimen DNA is combined with PCR reagent, which minimally include an appropriate buffer system containing magnesium, potassium, salts, deoxynucleotide triphosphates, fluorescently labeled probes, and DNA polymerase. So take note dun sa part that specimen DNA is combined with PCR reagents. And then, next slide, please. And just to add with the, just to add with that one, I have read that the sample are placed in a real-time terminal cycler for temperature cycling and fluorescence monitoring. So it could result for multiple rounds of DNA replication. And now let's proceed to the direct detection of herpes simplex virus. A direct smear from a herpetic skin vesicle can be stained with the GIMSA reagent to demonstrate viral multinucleated syncytial epithelial giant cells and intranuclear inclusions. However, these inclusions, it's no specific for HSV. So hindi lang to nakikita sa HSV alone. They could be identical to other kind of viruses such as chickenpox and shingles. Only 67% of herpetic lesions have positive gain sa zinc smear. And then we have here the immunostaining of direct smears with fluorescent or the immunoperoxide labeled HSV antibodies eliminates confusion with V, Z, V, and viral antigen could be identified in cells that do not yet have nuclear inclusions. So to eliminate confusion with the other viruses, we have here the immunoperoxide or the fluorescent. Next one, we have, however, when compared with culture, DFA staining has at best 20% or 30% false negative error. And all negative direct specimen test results must be considered as possible false negatives that should be validated by parallel culture. On the other hand, PCR diagnosis of mucocutaneous genital herpes infection is 20% to 30% more sensitive than culture and has a more rapid turnaround time than culture. So as always being mentioned, PCR, this is always used because it is superior for identification of asymptomatic mucocutaneous viral shedding 8 times more sensitive than culture. And now let's proceed to the next reporter. Thank you so much. This is Najmia Mimbantas.
For the serologic diagnosis, broad antigenic homology has been noted between HSV1 and HSV2. So accurate serologic testing requires antigens that are serotype specific. So the serologic diagnosis that are used, we have the EIA and the Western blot method. So EIA stands for enzyme immunoassay. So these methods are used because they are unique for HSV1 and HSV2 glycoprotein G. Enveloped antigens do not detect cross-reacting antibodies. And also the HSV2 specific antibody testing of pregnant women and their husbands helps predict neonatal transmission risk. Positive HSV2 antibody in a patient with genital vesicles or ulcers is highly likely to represent true genital herpes. IgM serology for HSV1 or HSV2, including the GG IgM antibody, is not specific or sensitive. That is why it should not be used for diagnosis of primary infection. Next, please.
So for the specimen collection and handling guidelines, HSV is probably the easiest and fastest human virus to propagate in cell culture. Antigen assays are also relatively straightforward procedures. Nucleic acid amplification tests are now widely available and have a superior sensitivity. Specimen collection is simple in this virus. So what swab do we use for this HSB? So this is done usually by rubbing a small cotton swab and on the skin lesion. Then the sample is sent to the lab. So HSB is sufficiently durable and present in sufficient numbers that stat transport and the laboratory handling are no essential. Swab specimens in VTM with antibiotics can tolerate a room temperature of 22 degrees Celsius, transportation delay of 12 hours with only a modest viral loss. Specimens should be inoculated to cell culture on the day of receipt, but overnight refrigeration is acceptable in this manner. Next slide.
So for the treatment, we have acyclovir therapy. So acyclovir is used to treat the symptoms of chickenpox, shingles, herpes virus infections of the genitals, such as sex organs, the skin, the brain, and mucous membranes, such as lips and mouth, and widespread herpes virus infections in newborns. Acyclovir is also used to prevent recurrent genital herpes infections. Next, please.
So we'll proceed to prevention and control, preventing new HSV1 infections. Most HSV1 infections are acquired during intimate but not necessarily sexual contact. Family members are the most likely source, but others are also at risk when saliva sharing behavior can occur. Although there are no licensed vaccines to prevent HSV1 infection, certain strategies may help reduce the risk of transmitting HSV1 to someone without prior infection. As an example, when a patient has an active outbreak of oral HSV, or a patient should avoid kissing or sharing utensils, glasses, water bottles, towels, or lip balm. Although this may not produce the risk completely, since asymptomatic shedding can occur. Transmission is since most likely the setting of lesions. Next, next please. So other strategies may also reduce the risk of transmission. Select settings. So healthcare workers. To prevent acquisition of SSB, infection healthcare workers should gloves during physical examination a patient with active HSV lesions for examination of mucous membranes. Sexual transmission. Patients with oral HSV infections, primary or recurrent, should be educated that they can transmit HSV1 through oral sex to uninfected partners, which may result in genital ulcers. Third is herpes gladiatorum. Cutaneous HSV1 infections are common among certain athletes, such as wrestlers. To prevent transmission to others, athletes should not participate in contact sports until all herpes lesions have entered the dry crust stage. Next. So thank you for listening.